India is a very large country of more than 1.4 billion people, and there are very few rheumatologists, about 1,200, to serve this very large population. In India, we have more than 140 million patients who are waiting for rheumatology treatment and specialists to come along and help them. In my practice in rural Bihar, operating out of a mission hospital, I came across many cases with rheumatological disorders, and I was unsure how to treat them fully and how to treat them well. This course by BMG motivated me to take the modules online and to attend the hands-on training, and it has been a great opportunity and a great learning experience for me. Through this course, I hope to be able to offer my services in a better way to needy people and to people who are often having limited access to good health care. And therefore, this work of BMJ extending through online programs is helpful to reach the farther, and also into interior places where patients are suffering and need expert care. This course has been very well designed, structured with different modules, and has given us an opportunity to have a self-paced kind of approach to learning. In the midst of our busy schedules as physicians, bringing out 1 to 2 hours per week and putting it aside to learn has been extremely helpful to me. It gave me an opportunity to reflect. It gave me an opportunity to correct. It gave me an opportunity to serve in a better way. Rheumatology is on the cutting edge of growth in these days, with several new advances in treatment. And an opportunity like this to come to a teaching hospital in Bangalore, to see patients, to interact with them, to talk to very well-versed and authorities in this field has been an extremely wonderful experience for me. I think when I go back to Bihar, India, where I stay, North India, I'm going to have a rheumatology clinic. I'm going to serve patients in a better way, explore modes for better diagnostics for them, and explore modes to serve them in a better way. Thank you very much for this opportunity, and thank you very much for investing in me so that I can serve others. I would like to thank those leaders who are part of the BMJ, both in the UK as well as in New Delhi, and also the excellent team of rheumatologists and teachers who have invested time and energy in making this course so very meaningful for us. I would rate this 10 upon 10. I've learned everything that I've learned a lot that has been offered, and I feel that this is going to catapult me into a new way of serving others. And so I will highly recommend this to others, both within Bihar, North India, and those within my circle of influence. Thank you very much to the BMJ team. Thank you very much to Dr. Danda, and thank you very much to Dr. Simi and all the team members who have invested in such a dedicated manner to help all of us 19 students to progress. Thank you.